Good morning, Mr. Robinson.
Morning.
My name is Dr. Taylor. I'm going to be the one doing the visit with you today. Tell me, what brings you in today?
Well, Doc, I haven't been in a couple of years. I figured it was time to get checked. I know Dr. Williams kind of left the practice, and honestly, I just haven't wanted to come in and see another doctor. Dr. Williams was good. We kind of really connected.
Yeah, I know Dr. Williams very well. What was it about him that really worked for you?
Well, he never rushed me.
Uh-huh.
He always listened carefully, to what I had to say.
I will do my very best to do the same. So tell me, what brings you in today?
Just for the last month, I've been kind of short-winded. I've been walking the metro rail lines at work, and my legs have been swelling up.
Yeah, I can understand why that would be pretty concerning for you. Tell me a little bit more about how you're feeling.
I don't know, maybe I'm just not as young as I used to be. I used to be able to walk the tracks all day long without any problems. Now it seems like I'm having trouble keeping up with the young guys. And they've been kind of making fun of me, saying I'm an old man now. Starting to think that maybe they're right.
Well, I'm really sorry that you're not feeling like your normal self. Is there anything else going on?
For the past couple of months or so, I've been having a hard time breathing. Been sitting down and resting a lot. My supervisor also has noticed that something's off with me.
Okay, so I'm hearing that you're having this difficulty breathing, you're having to rest a lot, it's starting to interfere with your work, you're not feeling kind of up to the same level of activity as you're used to. Is it okay if I ask you a few more questions and we try to figure out what's going on?
Yeah, sure.
All right. So when you have this shortness of breath, do you ever notice that it's waking you up in the middle of the night?
No.
And have you noticed that you're sleeping with more pillows than usual?
One more maybe.
Okay. When you're having these episodes of shortness of breath, do you also have chest pain?
No, I'm not having any chest pain.
And what about any feelings of dizziness?
No.
Do you feel like your heart is beating really quickly or beating really hard, like it's going to beat out of your chest?
No.
Okay. I saw on your chart that you've got some high blood pressure. Are there any other chronic illnesses that you are being followed for?
No, that's enough.
Okay. What about any illnesses that might run in your family?
Well, both my parents, I know they have hypertension.
Okay. Anyone in your family ever have a heart attack or have any history of heart disease?
Not in my family, no.
Okay. Have you had any long trips recently?
No, I wish.
Okay. And what about any pain or swelling in your calves?
Like I said, just my legs have been swelling, but I can't say specifically my calves.
Okay. And is it both legs or just one?
Both.
Okay. Do you use any tobacco products?
No, I've never smoked.
And do you drink alcohol?
Rarely.
And do you do any recreational drugs?
No.
Okay. Is there anything that you can think of that, might be bringing this on?
I was thinking maybe I could have congestive heart failure.
Oh, what makes you say that?
My wife Rose, she talked to her sister Laura about what was happening to me. Laura is a nurse practitioner in LA. She actually said the words congestive heart failure. She sent us a couple of articles too. One was from the New England Journal, and the other one was from Circulation. And the articles basically said that black men and women got congestive heart failure under 50 years old more often than whites. Yeah.
Yeah, those are some good journals. They know what they're talking about, and I'm sure it didn't feel good to read those articles.
Not really. Also kind of made me think about Mark. He had a heart problem.
Would you mind telling me a little bit more about Mark?
My best friend Mark, He died last month from heart disease. He same age as me. We grew up together. I was the best man at his wedding. He has 2 daughters that miss him terribly.
Yeah, I'm really sorry to hear about what happened to your friends. Could you tell me some more?
Mark had a heart attack a couple years ago while he was working out at the gym. He suddenly collapsed while he was on the treadmill. The gym manager there had to perform CPR while somebody ran and got a device to shock his heart. Mm-hmm. He basically was kind of shocked back to life. When they got him to the hospital, they told him that his coronary arteries were clogged and that his heart wasn't pumping very well. They ended up putting in a stent, started him on some medicines, and they let him go a few days after that. Mark went back to the hospital, to the emergency department a couple months ago, complaining of some chest pain. And he said they kept him there for a little while. They ran an EKG and got some blood work. And then the doctors there said he was good to go home because he was young and his pain was atypical. They said he could follow up with his doctors as an outpatient.
What happened next?
He literally had a heart attack a few weeks later when he was getting ready for work. His wife found him on the bathroom floor. She tried to perform CPR, but she couldn't save him. She didn't have one of those machines that they had at the gym.
Please go on.
Laura said it shouldn't have happened.
Why did she say that it shouldn't have happened?
Like I said, Laura's she's a nurse practitioner.
Uh-huh.
And she said that the heart doctor should have put in something called an ICD. It's a device that shocks the heart into beating again if it stops. Mm-hmm. She said that maybe she even should have done a bypass surgery. But they didn't do any of it. I don't even know if they told Mark about these options. And the more I think about it just shouldn't have happened. It just kind of gets me upset.
I'm really sorry that this happened to your friends, and I completely understand why you're feeling upset.
Too many black men keep dying. And Laura says that black patients get treated different than white patients.
There is truth to that. There are a lot of studies that show exactly that.
What happened to Mark is bad enough. Laura says black patients with congestive heart failure, it's just even worse.
From what I know, Laura is right. There's a lot of evidence in medical journals, and there's a lot of stories just like Mark's that show that many times black patients receive inferior care and they don't get the same outcomes as other patients do. But I want to reassure you, Mr. Robinson, that I'm going to do my best to give you the absolute best care that you need and that you deserve. And I would understand if you also might have some reservations about me because I identify as a white male provider. I know that this can be a lot and that sometimes it can maybe feel a little bit overwhelming, but I want to reassure you that my goal is to work with you and to get you the best possible solution to your problem.
I appreciate that.
Would it be okay if I shared some of my thoughts about maybe what we could do for next steps?
Sure.
Okay. So the first thing I want to do is I want to make sure that we run some tests. So we're going to do an EKG, we're going to do a chest x-ray, and we'll be able to get the results of those tests within just a couple of hours. I'm also going to do a physical exam just to kind of check you out, make sure that everything is going okay there. Now I also want to get some blood work. There's a possibility that this is a heart problem, but it could also not be a heart problem. And if it is a heart problem, I'm going to refer you to the cardiologist that I refer all of my patients to, and they'll be able to work with you to, again, go for some next steps for there.
Sounds good.
The other thing is I want to follow up. I want to see you again in about 2 or 3 weeks' time. Would it be helpful if we involved someone else in that appointment? Maybe your wife could come with you, or I'd be happy to speak with Laura over the phone as well.
I would like for you to talk to Laura, because she's kind of the medical person in the family.
Yeah, I would be happy to do that. We can definitely set that up.
Okay.
All right. Well, if it's okay with you, let's go ahead and do the physical exam.